Hello, my name is Prajwala, and I'd like to present about Tourette syndrome today. I would like to thank Dr. Stein, Dr. Bernard, the AMIQT team for giving me this opportunity. I chose Tourette syndrome because one of my favorite singers recently came out with this diagnosis that she had since childhood, and I was interested to learn more about it. So let me just run you through the topics we're going to cover today. First, I will go through the overview, which includes the definition, some history, and some interesting facts, epidemiology, clinical features, and then the approach to the patient along with the mechanisms. So the overview. First, Tourette syndrome was thought as a purely psychiatric diagnosis, but the DSM-5 now defines Tourette syndrome as a neurodevelopmental disorder characterized by multiple motor tics and at least one vocal tic for greater than 1 year, with an onset before 21 years of age. In contrast, the World Health Organization in its ICD-11 guidelines requires only the motor tic for diagnosis, irrespective of the presence or absence of vocal tics. So this study is by Paulus et al. And it was published in the Brain Communications Volume 3 in 2021. Here we see healthy controls as the red circle and the patients with Tourette syndrome as the blue circle. And we see that people have been diagnosed with Tourette syndrome despite having no vocal tics. And hence, in the future, this may not be required criteria for Tourette syndrome. So a brief history. Tourette syndrome was first described by ancient Greeks, though they had not given a detailed recording, and they had just described some tic-like disorders. The first case report was documented by Gaspard, who studied under Laennec, the inventor of the stethoscope. Then under Charcot in 1884, de la Tourette described 9 cases of the disorder, which later took on his name. An interesting fact about this was that he was later shot by a psychiatric patient of his in the neck, and this led to depression and hospitalization. But he was a very hardworking person and celebrated by Charcot. So as I mentioned, this is the singer and pop sensation Billie Eilish. And she recently came out in the Ellen Show in 2019 about having a diagnosis of Tourette syndrome. So she struggles with the disorder, and I will later show you a video where she explains how it feels for her. Some epidemiology. So it is most prevalent in males with a 4:1 ratio. Almost 3 out of every 1,000 children in the United States are affected. Usual onset of tics is at 6 years, but it could be earlier. Peak severity is usually between 10 to 12 years of age, and it later decreases in adolescence. This is hypothesized to be due to development of the prefrontal cortex, which helps control the tic diseases, as we see later on. So Tourette syndrome, an interesting point is that it is associated with so many comorbid diseases, the most prominent of which are ADHD and obsessive compulsive disorder. They can also be associated with mood disorder, learning disability, executive dysfunctions, panic, memory deficits, and so forth. The most defining feature of Tourette syndrome is the simple and complex tics. Tics are repeated, unwanted, involuntary movements or words that the patient is unable to control. So motor tics can include facial grimacing, blinking, shoulder shrugging, hand jerking, and vocal tics can include throat clearing, lip smacking, barking, sniffing. This is Casper Lee, a YouTuber who was famous for his animalistic noises that later turned out to be a diagnosis of Tourette syndrome. An interesting point about Tourette's is that most patients describe something called premonitory urges. These are prodromal to the tics, where there are sensations such as mental urges, the sensation of heat, cold, tension, incompleteness, and this is expressed by many people and is relieved by the movement, which is the causation of the tic. Complex tics are basically tics that resemble a purposeful movement. This includes body twisting, jumping. Echopraxia is an interesting phenomenon where a person imitates the other person involuntarily, and echolalia is where they repeat the person's words. Palilalia is repeating the sentence multiple times, and coprolalia is the utterance of obscenities and words that are socially inappropriate.
Billy, yeah. Next billboard session. Where's this going to be? You know, like how you saw the first round of billboards with the album cover?
Yeah.
This is going to be the second round of those.
Okay. Hold on. Something's happening here. Wow. Wow.
What is it?
I think attack. No. I don't know why though. It's been like coming on all day, but I can't like.
Do you want oil?
Yeah. Mom, do you have the essential oils?
Yes. Put it on your pulses too, so you can.
Okay.
Yeah, those are.
And some water.
Everything while it's folded is
Ah!
Okay.
I don't know why the lights are like really making them like.
Well, you're really tired, probably.
Yeah.
Yeah, that's probably what it is.
I've done some crazy shit because of my Tourette's. I fucking broke a glass once in my mouth because of him. Because I have this one where I'll bite down on something. Like if I have something, I'll just go really hard. Just because my brain is like, do it.
I really like the way she explained the premonitory urges, saying that her brain tells her to do it and she has to. Okay, so that was beautiful. Now for some etiopathogenesis and mechanisms. It's a multifactorial disease with involvement of genetic factors, neurochemical factors, immune factors, and most of the conditions seen in the clinic are just the tip of the iceberg because some still believe it's just a behavioral issue, and it can also be associated with trauma and drugs. So genetic factors, when Adila Tourette was recording his 9 cases, he described a positive family history of the work, but then until the 1960s when neuroleptics were discovered, it was thought to be a purely psychiatric condition. But later studies in monozygotic twins show concordance of up to 53% in Tourette syndrome and up to 77% in all tic disorders. Some of the risk genes found are CNT-N6, NRX-N1, SLIT-RK1, HTC, and CEL-SR3. But this only accounts for 2% of the affected individuals. This could be due to incomplete genetic penetrance or other etiological factors, and there are many other theories that explain Tourette syndrome as well. So neurochemical factors include hypersensitivity to dopaminergic transmission. This was one of the earliest theories because of the invention of neuroleptics, which proved to be an effective treatment for Tourette syndrome and is still being used. So a cortical striatal thalamic motor loop is basically the pathway in the brain which transmits information from the cortex to the basal ganglia and then back to the cortex. And this loop is basically responsible for planning and movement and behavior of the involuntary actions. And damage to this pathway could basically be the reason for the involuntary tics. In neuroimaging, caudate nucleus is proven to be smaller compared to people without tics. And in children, they have found a larger prefrontal cortex, which is hypothesized to be because of trying to control the tics and regulate them in such a way. So here we see the motor and sensory cortex and the putamen being stimulated during the genesis of the tic, and also during the premonitory urges. So this is a beautiful diagram that shows us that. And during suppression of said tic using, say, behavioral therapy, inferior frontal gyrus gets activated, and also subthalamic nucleus is responsible for the inhibitory signals. So there is also an immune response that could be responsible for Tourette syndrome. And there are many prospective studies that show an increase in IL-12 and TNF. One key point about this lecture is that this helps us differentiate OCD from Tourette syndrome. And this is the take-home point because OCD is so commonly associated with Tourette syndrome. So here in OCD, there is decreased levels of these cytokines, whereas an increased level is present in Tourette syndrome. So this is a very important point. Autoimmunity is one of the most conflicting study that is present about Tourette syndrome. Some studies say that antiphospholipid and antineural antibodies against the putamen and other basal ganglia are seen, but also there are studies refuting this as well. An interesting point is that some people get the first appearance of a tick after they get Lyme's disease or mycoplasma or streptococcal infection. And this hypothesized the post-infectious immune response phenomenon. And point is that these ticks are resolved by antibiotics. One of the most extensively studied association of Tourette syndrome is pediatric autoimmune neuropsychiatric disorder associated with streptococcus or pandas. Okay, so pandas is a very similar disease to Tourette syndrome, and some people even hypothesize that it may be a subset of Tourette syndrome because the main symptoms are motor and vocal tics with obsessive compulsive behavior. So we also see in studies that there are cross-reacting antibodies against the putamen, especially of the M proteins, which is commonly seen in rheumatic fever and other streptococcal diseases, and particularly the M12 and M19 autoantibodies, which attack the brain, have been determined in many studies. An interesting point is that streptococcal infection can present with Tourette syndrome either during the infection or after the infection. And this causes a difference in treatment modalities, which is that during the infection, you would be treating it with an antibiotic, whereas post-streptococcal autoimmune process may respond better to autoimmunomodulatory therapy. Okay, some of the differential diagnosis. It is very important to look at the differentials because they are almost the same disease, but they do not meet the DSM-5 criteria to diagnose it as a Tourette syndrome. Sporadic transient tic disorder. This is as obvious as per name, is that it lasts less than 1 year, and hence it does not meet the DSM-5 criteria. But other than that, it is most similar to Tourette syndrome. Persistent motor tic disorder or persistent vocal tic disorder is a condition where there are only motor tics or only vocal tics, but not both. And adult onset tic disorder occurs after 18 years of age, and usually Tourette syndrome presents in childhood. Other differentials can be tardive dyskinesia, choreiform movements such as Huntington and Sydenham chorea. Spastic Newton's is a condition where there is compulsive head nodding, and that should be differentiated from tic disease. Myoclonus and even metabolic conditions like Wilson's disease can cause tics, which should be differentiated from Tourette syndrome. Okay, now for approach to the patient. This Tourette syndrome is a very scary diagnosis for the patient as well as the caregivers, and counseling and education of the process is not only helpful, but also has proven to be prognostically better for the patient. Whereas if a patient is not accepted or bullied, that can lead to low self-esteem, and it can also cause a prolongation of the disease. Tourette Association of America is one of the organizations that support Tourette patients with online support groups and weekly podcasts, which has been very helpful. And they also connect you with a provider in case you might be experiencing the symptoms. So behavioral therapy is for patients, and it can be used as a monotherapy in case there are not many disabling conditions. And this includes habit reversal training and cognitive behavioral interventional training. And these have been found by the American Association of Neurology to have a very high confidence interval, as we will see in the future slides. So medical therapy is for severe and disabling symptoms. The first line treatment is an alpha adrenergic agonist called guaifenesin, and clonidine is also used, but has side effects, and guaifenesin is more commonly used. Neuroleptics, as we saw in the mechanism, blocks D2 receptors, and this has a very important role in the therapeutics of Tourette syndrome. This includes pimozide, haloperidol, flufenazine, which are typical neuroleptics, but are less used because of disabling side effects and extrapyramidal effects. Atypical neuroleptics includes risperidone, which is gaining popularity because it has less disabling side effects. Dopamine depleters such as tetrabenazine can also be used. deep brain stimulation of Tourette syndrome is not yet FDA approved, and the company Medtronic has not yet conducted any tests, but in a class 2 study of the American Association of Neurology, it established a moderate confidence interval in evidence for deep brain stimulation. And patients have experienced a dramatic improvement in their tic disorders as well as in their livelihood, and this may be a very important future therapeutic. Other AN practice guidelines that was released in 2019 based on a randomized control study with double blinding was that there was a high confidence interval in those receiving comprehensive behavioral intervention rather than supportive psychotherapy, and also moderate confidence interval in antipsychotics such as haloperidol, risperidone, aripiprazole, tiapride, and clonidine, which is an alpha-adrenergic receptor agonist. And there is also evidence of use of Botox and other drugs. So patients with comorbid ADHD would benefit from methylphenidate with or without use of clonidine, and also a drug called desipramine. Finally, we have the prognosis of Tourette disease. The important thing about this is that patients will have a normal lifespan and it does not affect their intelligence. Usually, symptoms peak around 10 to 12 years of age and resolve completely by the end of adolescence. In the study by Fernandez et al., we see that a complete resolution is seen in 40% of the cases, whereas other 40% has mild to moderate tics. 20% have reported that their tics increase in adulthood, but more studies have to be conducted on this. In conditions where this tics increase in adulthood, it can be a debilitating disease, and support groups are available to manage their symptoms. Quality of life can also be impaired, and there is a conscious attempt to suppress the tics, as we saw in the mechanism with the prefrontal cortex, and this can cause headaches, pain, and I read an interesting case where this caused cervical disc herniation in a patient. Many people live undiagnosed with this condition, and this causes low self-esteem and can affect employment choices and opportunities. So a take-home message about Tourette syndrome is that it is a disabling condition, and that many treatment modalities are available, and since clinical cases are very few, it may not even present with tics, and people and community awareness has to increase about this condition. Thank you.